Hi, I'm Lisa, and I'm the founder of Rest Ministries, a Christian organization that serves people who live with chronic illness or pain. If you'd like to visit our website, it's at restministries.org. I'm doing a short series of videos to explain a little bit about my recent joint replacements. I said I'm now a bionic mom. Little by little, there's probably going to be body parts that are new, so I'm just going to claim it and go with it. So this is the splint that I have to begin with. This is the one I wore for about 12 weeks. They did tell me at first it would be about 6 weeks, and I thought, oh, okay, so I'll have a splint maybe 3 or 4 weeks, and I can drive. I'll wear it a few more weeks, and then they said 6 weeks after that at nighttime as well. Well, I found out there's no way you're driving in this. Not only is it not safe, but it's not legal, and your fingers don't learn to grasp the wheel quite as quickly as you might imagine. Each finger has a new joint, and I found it interesting that when they first said make a fist and you start bending, your brain has to kind of relearn to make a fist and close all fingers at the same time, because I would be maybe closing one and I'd be thinking about my index finger as tight as it could be, but then the others would be loose. And they do measurements to find out how far they actually are bending and what kind of progress you're making, and so you're trying to do your best. And so there's a lot of interesting stuff about how your brain sends the signals or retrains a muscle to lay a certain way. So I would say, no matter what you do, don't be discouraged, but do know that it's going to be a commitment and have a backup plan. My mom graciously came and stayed with us for 6 weeks, and she was very helpful. She did everything that I normally do, like laundry and cooking and driving and picking my son up from school and all of that. At the same time, find out what you can do for yourself, because you do want to keep your other hand active and keep working, and then they will tell you, the therapist will tell you when you're able to start using it for little things. The first thing she said is no typing. Absolutely not. Because I said, can I just type with my just one index finger and just do tick, tick, tick? And she said no. So that was a hard one for me. But you don't want to use it because you don't want to put any extra tension or exercise into one without doing the others. You strictly are doing the exercises. Now, a lot of people don't like to sleep in something like this, obviously, so you can ask your therapist about a nighttime splint. This one, as far as price, for me ran about $300. If you're just looking for a ballpark figure, everyone is different, but it comes off very easily, and you end up with your sock. One of the things that drove me nuts is I was sweating all the time in these. I had about 5 of them, and I would be washing and drying them constantly. Being on prednisone and other medications, you feel like you're always hot. Now, this is the nighttime splint that my therapist made for me, and I have to say I didn't end up wearing it a lot because I felt really limited in what I could do, even just to straighten out my fingers to grasp a sheet or a little bit. But once again, it's a lot of Velcro, and it all, let's see, it crosses. It does a lot of the crisscrossing thing, and it's like this, so it's like wearing a big mitten, basically. Keeps your fingers straight, keeps everything straight, and it's easier to sleep in as long as you don't want any use out of this arm, but you don't have the outriggers like on the other one, dangling up here and catching on things and that kind of thing. Be sure, again, as I said in the other video, to talk to your therapist if it's uncomfortable and you're not going to wear it. They have a lot of things they can do. You can see on this one there's a lot of little padding here. The original one she made me was this kind of plastic that they take and they melt, and it had places for my fingers in here, and when I put it on, it just felt like it was pushing my fingers too far in the wrong place. And so she said not a problem. She punched some more holes in there and ended up doing something with Velcro to hold these fingers down. So don't be afraid to let them know how it feels. I know a lot of times when you're in a cast and you come out of surgery, what you get is what you get, and you don't really have a lot to say, and it's not meant to be comfortable. It's meant for you to heal correctly. So you feel reluctant to say anything, and if you do, they're probably just going to say tough it out. That's how it works. But when you are wearing a splint like this, It's wonderful to have a therapist that's willing to work with you. And you know your body better than anybody. So if you know your fingers naturally go out like mine did, and you put something on and it feels like it's pushing them out again, and you know the idea is to push them this way, mention that to them, because it may look okay, but you can feel the tension in certain places better than they can see it all the time. So this is the next splint, and we are going to go ahead and move on to the next video then, and I will show you what I called my torture device. So we'll see you in just a minute.